Well, good evening. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I have a most interesting case here of multiple problem case. This young lady has oversized adenoids, and they're going to have to do something with that to open the airway. She's got a cuspid over on the in between the lateral and the central. We're going to have to slide that over, slide one tooth over another tooth, and I'll show you how we do that. We just let the tooth float while we cross over it. And there's several other problems in here, crowding situation, and also where somebody did a root canal on a infected deciduous tooth. And this hardly ever works, and it forced the development of the developing bicuspid down there to be down real low. So we'll touch on that too. So let's get started on it. And I'll try to cover it as fast as I can here. This is the lower arch of this young lady, and we're planning to go in and take out the deciduous second molars over actually this is the first molar. You got your deciduous cuspids, and this is the second molar, deciduous molar back there. Now here the lateral, this cuspid is coming in right in here and is forcing this root of this central off to an angle like that, and the lateral over in this direction, and this cuspid is located somewhere in this area right here. I'll show that to you now. That alone is a problem, moving this cuspid over and bringing that lateral back and then lining this tooth up. So you got your work cut out for you in this thing. And this is 1984 when we started this case. And so let's get on here, and I'll try to show it as fast as I can. And I want people to learn how to do this type of orthodontics. Now over on this side, we're going to take out, this is what we're planning to do, get the bicuspids and the deciduous first molar out right there, the deciduous second molar actually. Now, same way over here, this bicuspid is already coming in, and we'll get this one right here. It is a delayed eruption of this one down here, right there. So we'll show that on the x-ray after a while. Looking at the young lady's face, you just wouldn't suspect that all this is wrong. I mean, you would think, well, this is a perfectly simple case if you start out on it like that. But there's a lot of things wrong here. This is why I should touch on this, that you don't charge orthodontics by the case, but by the things that are wrong in the case, and you have to do those. So let's get on with it here. You can see that central twisted off up there like that. There's a cuspid stuck up there in between that central and the lateral. Looking from this side, the profile, even though she's a mouth breather to some extent, the vertical dimension of the face looks quite well, and the profile looks quite well. And we're going to have to take out some bicuspids here, and it'll still look well because we're going to go back and take out distal bicuspids. Now here's this case where this deciduous tooth right here was crowned and treated, and there's a delayed eruption of this bicuspid. You won't see it really good until you get into the panorex in just a few minutes. So, all right, we'll go ahead here. Let me go back here and see. Now at this point, we don't get a good view of the adenoid tissue coming in here, but it's pretty good size right in there, and I have another self later on, and you can see it much better. All right, we're looking straight on at it. The side again, and there's that cuspid tooth between the upper right central and the upper right lateral right there. Okay, now this is a second bicuspid. This is a deciduous second molar. The first one is gone. All right, so here again, take out those teeth. We're kind of duplicating things here now. All right, you can see much better at this point, like this crown right here, or not a crown but a big filling over this tooth, and this trap this cuspid, this bicuspid down in here, but it's going to make its way out. And over on this side, they did a pulpotomy and fill that all in and save that tooth, but this tooth is not developing properly right here, and it's going to be way down there when this one is already up in clear view. Now this is the first Pediatric, and this was taken in 1984. You can see right up there. Here in 10 of 84, we have taken those deciduous teeth out right in here, and this bicuspid has been interfered with the eruption of it, and it's still down there. We come over this side, and we're going to take out the deciduous tooth. Let's look at the next X-ray now. All right, here we've gone in and removed this deciduous tooth in here, and this tooth hasn't grown, and this one is way on up here, even though it was real crowded in here, and we'll have to take that out. Now the cuspid, you see, we have moved it over the lateral to some extent right here. Then we go back and we'll see, you see the cuspid is right in between the lateral, and the secret of that is let this lateral kind of float. Don't try to push it out of the way. Just go on top of it, slide this cuspid over, and then push it way back, and then you bring it back into position later on. So we come here and you see that we are doing that. We move this over the lateral, and it's coming back in position right now. So this is a pretty hard thing to do in orthodontics. And now we're going to come back over and talk about possible extraction in here. And so we come back, this is 1985 now, and we've got everything lined up pretty good. The wisdom teeth are coming in. You can't see this one over here, but there's one there. And you'll have maybe room to bring the wisdom teeth in if we eliminate this. Now see this lateral that was curved in here, and this cuspid had a crooked root where this central, where the cuspid was erupting in there. This cuspid was over in between here. Now, all right, so we take out the permanent second bicuspids on the case. And this one down here, you can see where the tooth was. It just wasn't coming up. So we eliminate that, and eliminate this, and this. And that's what we started to do. Now we're going to bring this down, this in here, bring it up, close this space, and keep these teeth in a forward position right here. So sometimes you have to put a tad in here to keep these from going back as you close the space. Now this X-ray is a 2 of 86. So this doesn't just happen over night in here. Now get on to the next one. is January of '87. You see, we started out in '84. Now, we've closed this space in here, and you can't even tell where it was. This wisdom tooth, I think, made it in, but this one over here, the girl just didn't grow the same length of jaw. But as far as I remember, with this one, we lost the wisdom teeth on the left side of the mouth there. Now we come on back here. This is 1987, and there the case is. We've done everything in there. We got these teeth right here close together. Hang out here. We're gonna keep these deals. We'll have to go back now to. Then we go back into the. There we go again. Now we're back in showing it in the right deal. We saved the 8s up here, but we don't have any evidence of it here. This is 1987, and we're gonna let me get this dot back in over on this side here. All right. But I think we saved them on one side, but I don't think you could make room enough to get this in over here, even though we moved everything forward. We moved it forward here, and this one, probably we got that in, and the upper one would come on in okay. But I don't have any Pediatrics past 1987. Now here we are, 85. We're going to go back to the just the facial pictures. That's lined up with a little flexible wire in here, and you can see we moved this lateral, this cuspid from over in between there, and then we straighten this tooth up, and this one, everything lines it up in there. Now there, the lateral, see, we let it go way back in, and then we're coming over with the cuspid. See, the cuspid's right in here, and we're going to cross over this lateral and let it, in fact, you could just undo it and let the crown slide over back. Get over on the other side, then get again and pull the, what we're doing here, we've already slipped the cuspid over it. The cuspid was up here, and now we're pulling this lateral up, and this is the cuspid. I get turned around myself with what we did with the tooth. Now, all right, down on the bottom, this is the tooth that didn't come in. It just wouldn't come in, so we go in and take out the bicuspids, and I think we ended up taking them out on both sides. We did, and we bring this back, and now we get the midline lined up. This is 1986, and you see this central is straightened up. It was sitting in there like that. It's straightened up. We got the lateral in here and the cuspid right over on that side. And that's a pretty hard thing to do if you haven't done that before. You kind of let this one float as you cross over it, and then put it back into position as you change it. Now let's go on. This is 1986, and you can see the palatal roof up here. We've taken the second bicuspids out on the case, and here we took them out, and the space is there. Now this is 1987, and the space is closed up, and then we got the midline just pretty well lined up. There'll be that much difference in this tooth size. And here it is. Let's see. It's 1987, and everything's lined up. We got rectangular wire, in there. We're finishing the case out. Now this is, I don't have a date on this one, but space is closed now. Now here we go in 1987. All right, now this this cephalometric shows you what a big adenoid tissue this young lady had, and you need to get that thing out of there and open this airway and get them where they breathe properly. And we, of course, send that ENT guy to take care of that, and maybe take the tonsils at the same time. I don't remember exactly, but we clear the airway in that respect. Now here is some pictures, 1987, and we're still in the braces, and we started in 1984. So we've been in there for about 3 years. Now here is 1991. She's cut her hair off and dyed it red, and it's the same thing, but we've got almost an ideal vertical dimension of the face. And there, this picture there is not too good. She's closed her eyes, but she's smiling, and you can see the lip line on the teeth is almost ideal. And here the face is again from the side. And now this is 1991. That midline is still off just slightly over here, but this cuspid that was central was headed that way, and this cuspid is over here, and the other lateral's over there, and we brought the root out, and we got the same torque on it as we get on the one on the other side. And this has taken a while to do, but this is a case with multiple problems, and you need to really look the case over solid before you start working it, and you make your charge for the case by what you have to do. Doing it is the best way to do it. Now that's 91. Here, and you can see these teeth are getting in there just perfect. That's your molars, your second molar, and I'm not sure about we tried to save the wisdom teeth when we extract bicuspids. I think we saved them on one side, but not the other, but I don't see them here. So anyway, we got the whole palate worked out, and it's a good looking case. So I hope you will pick up something from this. You don't just jump in there and start doing stuff until you thoroughly look at the case. And frequently down the line you have to change your diagnosis a little bit. The things don't come out like you want them to. Now, I take this back. You know, we said we saved the eighth. I didn't think I had a picture of it, but there, the wisdom teeth. I'm sorry, I didn't touch that. Let me get it back on there again. But the wisdom teeth were there. I'm sorry, I messed that thing up then. I'm going to pause this for a minute. All right, we're back in here again. So I was mistaken on the wisdom teeth. We took this bicuspid out, and the wisdom tooth came in, and you can see it on this see it on the case here. You can see it up the top there. The wisdom tooth is in there in place, and that's the wisdom tooth. So we did keep the wisdom tooth, and we lost the second bicuspids, but we were able to get room. So that's to me is a big plus. You save a real good tooth and sacrifice a bicuspid. One of those bicuspids would have, I would have never gotten it up inside the mouth. So I'm going to say goodbye, and hope you get something from this video. I'm sorry I misled you there for a while. I didn't think we did save the wisdom tooth. I didn't think we had a picture of it. But in 1991, it came in, and it has plenty of room. So thank you again for watching, and I'm going to close this thing out, and we'll see something else later on. And I hope you'll join our group and subscribe to our channels.